Distinguished and is Dr. Neha Gulvala Mam, working as assistant professor at Ahmedabad Physiotherapy College. Welcome you all on behalf of Parul University. I am happy to introduce you our today's resource person, Dr. Neha Gulvala Mam, who is going to conduct webinar on functional anatomy of pelvis. Dr. Neha Gulvala Mam is currently working as a physiotherapist in US, and she did her bachelor's study from India and doctorate of PT from AT Still University in US. And she is a licensed physical therapist in New York and have a 12 years of total clinical experience and also have worked as a clinical instructor. She is McKenzie certified therapist, certified kinesiotaping instructor, and a pregnancy and postpartum corrective exercise therapist. She is a part of Mom Congress and Capital Region DOLA. She believes in a holistic approach. As we all know, a human body works as a whole, and she won 2020 Innovator of the Year Award in North Country and was a speaker in 2020 Telehealth Physical Therapy Conference. She also volunteered for World Awareness Children's Museum, where she teaches Indian festivals and kids yoga to make them more connected to themselves. She also did content collaboration with ARA Women's Health regarding pelvic health. As we all know, pelvic health is so underserved field in the world which needs more attention, and as a physical therapist, we can definitely help and make a difference. Now I'm requesting Dr. Neha Ma'am to share her knowledge. Please ma'am, start your session.
Good morning, everyone. I'm Neha Gulvala, and thank you so much, Dr. Wrinkle, and thank you, Gaurav, for this opportunity. So today I'm going to be presenting on functional anatomy of pelvis. So why it's functional? What is the difference between like a functional and structural part? So structure means like we just talk about like what is there, like a bone or muscle, or how does it look like, the organs or lymphatic system or vessels or the nerves, while the function is the how do everything work together, like during our functional activity, like when we squat, when we eat, when we sleep, or when we go up and down stairs. So I'm going to start with first structural anatomy, so which includes the bones, muscles, fascia, nerves, organs, and circulatory system. So if I consider all of them together, as you can see all the bones, then you can see all the organs. Like I'm considering pelvic organs, so they are like intestine, our kidneys, bladder, and also some reproductive organs. And then you can see the circulatory system and some nerves here. Now, if we consider the skeletal system of pelvis, how the foundation of pelvis is being made, because everything is attaching to that, like muscles and everything. So that is like a base of our body, and which is made up of like major three bones. If we can see ilium, then ischium, and there is a pubis here. And it makes like two joints. So like one here, sacroiliac here, and the one is pubic symphysis in the front. And it is also connected with the hip joint, because it's like the flexibility of the hip or the movement of the hip definitely is associated with the pelvis. Same thing, sacrum with the lumbar, so lumbosacral joint, and also sacrococcygeal joint. They are all very important because they are connected. They move together. If one is affected, the other one can definitely will be affected. So here I'm going to go down further on the muscle aspect. So all the muscles, they go from lumbar spine all the way to the hip. They are all the part of our pelvis. And there are 43 muscles, but we don't have to go in details of each of them. I will just divide them based on like a hip movement and their connectivity to the pelvis, pelvic floor. So the major muscle is the psoas. So psoas muscle starts from here, T12, L1, L2, L3, up to L4 sometimes, and it can go all the way to our hip, like a femur. And iliacus, it goes from iliac crest and all the way to our femur. So both of them together helps a lot with the stability of lumbar spine and also the hip flexion motion. Here now the adductor group of muscle. They are like pectineus and hip adductors, and they attach to the inguinal like ring here and also the pubic bone or pubic symphysis. And it is very important major stabilizer of our body, which does the adduction motion for the hip. And there are glutes on the back part who does the abduction. And there are small muscles like obturator, they do like a rotation of the hip. Now, if we consider the relationship to the pelvic floor, as you can see, this is like pelvic bowl here. And the muscle of pelvic floor, they are like this. So if we consider the superficial layer, there is like a ischiocavernosus along the ischial ramus, and they have like a bulbocavernosus around here. And then on the posterior aspect, they have levator ani, which divides into ilio and pubococcygeus and the coccygeus muscle. And all these muscles, they share the fascia with the hip muscles, like a psoas muscle, hip adductors, and also they are covered with the glute muscle around here. So that's why glute medius and maximus muscle strength is very important for pelvic floor functioning. I will go in detail later on when we consider the functional anatomy, but I'm just kind of like give you more visual idea here. Now, a little bit more, if we look at the pelvic floor from the bottom, this is how it looks like. So they are divided into anterior part and the posterior part. If we look at the anterior aspect, here is the urethral opening, and this is like for female anatomy, it's vagina, and it is surrounded by here, the ischiocavernosus and bulbocavernosus and transversus perineum. So these three are superficial muscle, and they are in the anterior aspect. And the posterior muscles are levator ani, pubo and iliococcygeus, and there is one coccygeus muscle goes here, which attaches to the coccyx bone. And here is the gluteus maximus. So this muscle is like covering the posterior aspect of the pelvic floor. Now, if I can show the anatomy of like abdominal organs. So the whole abdomen is divided into 6 compartments, and it helps with to locate the organ in particular region. So if we consider the epigastric region, that's when the stomach is there, and then left hypochondric region, and where we can have part of stomach and some spleen, and right is like more liver. So right lumbar region and left lumbar region, and umbilical is more like a small intestine and large. Right iliac and left iliac and hypogastric is also like, more related with the intestine. Here on the left and right lumbar region, we can consider some part of kidneys as well, which goes all the way down here in the hypogastric region where the bladder, it meets the bladder. So here you go, like kidneys are on each side, and it goes into like ureter, and then having bladder and urethra at the end. And then we have the third one. So basically pelvis has 3 kind of organ system: our digestive, our urinary tract, and the third one is the reproductive. And reproductive, female, male, again, they are separate. I'm just considering here like a female. So basically they have like a uterus, ovary, fallopian tube, cervix, and vagina. And all these organs, they are supported by mainly pelvic floor. So that's why pelvis is so important. Not like most of the bone or the joints, if we consider in our body, like they are mainly muscle, fascia, nerves, and joints. But the pelvis is so important because it has a lot of influence from organs and also the higher centers like sympathetic, parasympathetic nervous system. So that is like another important thing I'm going to discuss here, because these organs, they have their functional influence not only come from the muscles and joints, but also like from the nerve innervation, that is sympathetic and parasympathetic. So the gut like supply from the sympathetic system comes from T5 to L2. So, and what does the sympathetic system do? They inhibit the intestinal motion. So that's why food can get absorbed. Nutrition can get absorbed in intestine. They constrict the blood vessels, redirect blood flow to skeletal muscle, and contracts the anal sphincter. So when we eat, we don't have to just kind of like it pass out, and it has to like stay in the stomach for the digestion, then in the intestine, and then it eventually it gets digested. Parasympathetic system and sympathetic system, they have to have a balance, because as sympathetic system, it inhibits the parasympathetic system helps to improve that. So that's how the food can move, because if we have food just staying in the intestine, it can lead to constipation. And if it's moving too fast, it can lead to diarrhea. So we need a balance between those two systems. Here is like a parasympathetic innervation, and it comes from S2, 3, and 4. Now, for urinary tract system, sympathetic nerve system comes from T10 to L2, and parasympathetic comes from S2, 3, and 4. The function here, I'm discussing this function because sympathetic and parasympathetic nervous system has a lot more relationship with the emotions as well. And this system helps with the organ function. So when sympathetic nervous system works, it relaxes the detrusor muscle of the bladder wall, and it contracts this urethral sphincter. So we have retention of the urine, because when the bladder needs to fill up to certain capacity before we really need to have desire to urinate. But if this system is not working, and if that detrusor muscle is constantly firing or contracting, and if the sphincter is relaxed, we can have the leakage or incontinence. We don't want that. In the other side, if that is overactive sympathetic and parasympathetic is not working at all, then we can have more retention and having a difficulty to urinate. So both system needs to be balanced. And now for the reproductive system, the nerve supply comes from S2, 3, 4 parasympathetic, and sympathetic comes from hypogastric nerves. They are similar T10 to L2, and also pudendal nerve that supplies some part of genital area, and that is sacral nervus at 2, 3, 4. Very important part of the pelvis is the blood supply and the lymphatic drainage as well, because pelvis is contained with the organs and the muscles which has the rich blood supply. So it needs to have like a lymphatic drainage as well. Otherwise, it can lead to swelling in that area. So that can drain into internal iliac nodes and external iliac nodes. Now, I was just going brief into the structural anatomy. Most important part is the functional anatomy. Why functional? Because in day-to-day life, we don't just sit, we get up, we move, we squat, we go up and down stairs, we get in and out of car or our vehicle. So every single thing is the functional. We breathe and we lift. So all these things, every single functional motion, there is not only single muscle is working. We have combination of muscles they are working, or combination of joints are working at the same time. So I'm going to discuss here how the muscle, they work in the chain, and how the joint, they are working, like how the joints are made. Like one joint provides the stability, at the same time the other joint provides mobility. Like when we eat, shoulder needs to stabilize here, upper torso, or like trunk needs to stabilize, trunk muscle needs to stabilize our whole torso. So our elbow can move and we can bring the wrist to our mouth. Same thing for pelvis too. When we walk, the pelvis needs to be stabilized. But how our arm and leg, they move, how the muscle, they coordinate to provide us balance, stability, force, and also like speed. So that's what I'm going to talk about here, and how organs get influence from this muscle and joint movement, how breathing can work and how intra-abdominal pressure can work. So that's the main reason why we need to work on functional anatomy. And that's another thing which is becoming very popular, that we do a lot of functional assessment of muscle over just working on like, okay, let's check just bicep strength. We need to make sure that along with checking the bicep strength in just like, here open chain, we need to make sure that they are working during functional motion. Like when I try to reach up to the cabinet, same thing, like, if I check hamstring, just as a knee band, like, hamstring strength, I need to make sure that they are working when I'm squatting, they are working when I'm walking, they are working when I'm going up and down stairs, how much stability I have it. So here I'm going to work with the kinetic chain of the joints. So alternate joint in our body, which is made to be for stability and mobility. So the upper highest one is the upper cervical spine, which is made for mobility. What does it do? Rotation of our neck. Many people, you need to always check that you have symmetrical rotation on both sides. Sometimes some people can have more tightness on one side than the other. That can affect the kinetic chain in other areas too. The middle cervical and the lower cervical spine is for stability, that provides stability to our head. Thoracic spine, major mobility aspect, because that even helps the shoulders to move. That even helps the hips to move. So whenever people have like a thoracic spine restriction, there is a high chance that hips are stiff. There is a high chance the lumbar spine is getting a lot of toll, because lumbar spine is for stability. SI joint, sacroiliac joint is for stability. Hip joints are for mobility, knees for stability, and ankle for the mobility. So now the bigger joints, like a wider, heavier joints, are mainly for stability. And so it starts from the middle and lower cervical spine to the lumbar and sacroiliac joint. The vertebra over there, they are bigger in size, and the knee joints. And then the mobility is from the upper cervical spine, the smaller joint, the thoracic spine, the hip joints, and the ankle joint. So any rotation, any deficiency in the ankle can affect the hip mobility, or any hip mobility can affect the ankle mobility as well. And same thing can affect the hip knee stability. So that's the reason why, like, people with the patellofemoral pain syndrome or with the ankle, sprains, we have to make sure that we work at the hip first. We need to make sure that hips are mobile, they are strong enough and working right, so like knees and ankle can function right. Now we can go further. The sacroiliac joint movement is also very important, because many times in the practice, sacroiliac joint movement is being ignored. It's such a small movement. It's very hard to see unless you really feel it. So that's why, like knee movement, it's obvious. We can bend the knee, straighten the knee. It's pretty obvious. But sacroiliac joint is like very minimal motion during our gait, during our going up and down stairs, any kind of like weight bearing work, or even like sit to stand. Whenever we are sitting, even they are working. So like mainly when you are walking, the weight bearing leg goes into the nutation. So like sacrum goes into nutation. Nutation means it moves forward and then downward, and in the opposite side it goes into the like totally opposite direction. So when it moves like forward and anterior inferior, it causes the locking of that joint. So this side of joint, suppose it goes forward inferior, it closes means it just kind of like helps to stabilize that side when you put the weight on that particular leg, and these sides open up, so allowing the motion to happen, forward motion to happen. So at the same time, when you are putting weight, suppose on the right leg, when sacrum goes into the nutation, it rotates to the right, and it even side bends to the right side. And the lumbar spine, it rotates in the opposite direction. And then thoracic spine goes in the, rotates to the right, and side bend to the left, and cervical spine goes in the, rotation and side bend to the right side. So they go in the opposite direction. So this is how you can see how, like, if someone is having like a neck pain, whether their problem is in the pelvis, their sacroiliac joint, or thoracic spine, where is the exact problem? Is it moving biomechanically right in the whole chain from neck to all the way down to pelvis to even feet? And so hip movement, as we know, they are like going into flexion. So extension, abduction, adduction, internal rotation, and external rotation. Knees are like flexion, extension. They have some rotation as well. And the ankle has like a very complex motion. But mainly it's like, dorsiflexion, plantar flexion, supination, and pronation, or you can go for the eversion, even in inversion. And so any kind of like a foot position changes, like if it is outward rotated, or it's like, more weight bearing on the arch is dropped, that can affect the hip motion, hip rotation. And that can even affect the lumbar spine or SI joint or the knee or the ankle joint, anywhere. And also like the hips are connected with the shoulder that I'm going to go through in the muscle chain. So, and also hip muscles are so connected with the pelvic floor. As I said, the glutes were covering the pelvic floor. And also the obturator is right there. So like adductors are right there. So they are all covered under, like, over the pelvic floor muscles. So what happens, like if hip is tight, the pelvic floor on that side can get tightened up and they cannot function. And out of all these 45 muscles attached to the pelvis, they make like a different chain. So like different author has like defined different ones. Out of that, Tom Myers has defined like several chains. There are 8 chains. I'm just going to discuss like 4 functional chains here, which is kind of like more like when we can check in functional positions, and that defines more functional movement as well. So like first is the anterior functional or oblique system, posterior functional or oblique system, lateral line or lateral system, and deep posterior longitudinal subsystem. All 4, they work when you do any kind of weight bearing activity. So why these chains are so important? Because they all work during walking, squatting, rolling, throwing motion, going up and down stairs. Even when we use, like when we urinate, or when we do the bowel movement, they are constantly working. So like when I consider the anterior chain muscles, how would you define here is like it is made up of, like if you stand on this leg, left leg, it's like a stance leg adductors, and then contralateral external oblique and ipsilateral internal oblique. So same side of internal oblique and opposite side of external oblique, and these adductors, they work together and make an anterior chain. And they work like when we walk. Suppose I will show you another picture when we walk, how we do it. One leg forward and the opposite arm forward. So they are working in the cross chain like this. And that's how we get the stability on this leg, and also we are more balanced. Now, posterior functional chain. It is made up from glute maximus, and it is connected through thoracolumbar fascia to the latissimus dorsi. It's so important to have latissimus dorsi length and a strength for glute to work, and the same rule applies. The glute strength is equally important for the latissimus. So now we can imagine why shoulder pain is associated with the hip issues, or if someone is having shoulder issues, they can have the hip weakness, or they can have pelvic floor dysfunction too. Because if the latissimus is not working right, if it is tight, it's pulling up like this, that can affect the glute muscle tightness or the weakness. And that glute covers our pelvic floor muscle. And also it stabilizes the sacroiliac joint. So it ultimately affects the pelvic floor muscle. Now, lateral chain. So how it is made? So lateral chain is like ipsilateral, so weight-bearing leg. You can consider adductors and glute medius minimus and opposite side of quadratus lumborum. So if they are not working together, we can have either side dropping of the pelvis, either it drops like one side or the other, and that can definitely affect the weight bearing on that particular leg. Deep posterior longitudinal subsystem. This is not the antagonist, they are more synergist. That means they are more supporting muscles, but they are equally important because it goes all the way from base of your neck to ankle. So if we consider all erector spinae from cervical spine all the way down here, and then it goes to sacrotuberous ligament. So sacrotuberous ligament is the ligament which attaches the sacrum to the ischial tuberosity. So it closes, it like stabilizes the whole pelvis in the from sacrum to ischial tuberosity, and that it transfers the load into biceps and then peroneal here. So part of hamstring and then peroneal muscle here. Now, gluteus maximus has also attachment of sacrotuberous ligaments. So even because here we are considering like a subsystem and synergist, glute is not being mentioned. But when we consider the function, definitely sacrotuberous ligament can affect the glute functioning as well in closing and opening the sacroiliac joint, which ultimately affects the pelvic stability, which affects our shoulder, pelvic floor, knee, ankle, anywhere. So those four systems, like, the muscle chains, now how do they function during the functional movements? Like there is an example of running here. This is taken from Vital Glutes book, and John Gibbons, he's like an author of Muscle Energy Technique, and he has like, he always solves puzzle by like treating if there is a shoulder issue, he really want to look at the hips first. And this is how like we are practicing as well, because then you can really find the root cause of the problem. So here the anterior chain is working, like the weight bearing leg, hip adductors, and opposite side of external oblique and same side of internal oblique. So see how it is working? This leg is forward, this arm is forward, and these two are backward. So this is how we get the balance. And now if we look the running from behind, so when this leg is having weight bearing, the glute and opposite latissimus, they are also working together. So if you are running and if someone is having pain here, or if like someone is having pain here, then always like make sure that always rule out the cervical spine first, but then after I would always look at the glutes, that there is no blockage going on in the glutes from somewhere. Now lateral chain when we step up. So this leg is weight bearing leg when this abductor and adductors are working, and that opposite like quadratus lumborum is firing, and they are stabilizing the pelvis. See how neutral it is. It's not like, it's just a little bit tilted, but it's not like tilted in opposite direction. So this is perfect, like a stable pelvis where it is like, these two are firing and balancing, and they are kind of like balancing with the quadratus lumborum at the same time. I'm going to go a little bit into the nervous system, like how parasympathetic and sympathetic nervous system work together for our digestive system. So when we get like a feeling of food, like, hunger, or like, when we are hungry, the mouth, like it stimulates the saliva. So that is parasympathetic system. They are all with the glands. They produces all kind of like, secretes them, like saliva, secretes the gastric, like a SCL and other enzymes. So that helps with basically the digestive process. And sympathetic nervous system, that helps with more not producing excessive saliva, or once we are done using it, they just stop producing it. So we don't have like drooling, or we don't have issues with the gag, or it's not like over. So it helps to like reduce the production of like enzymes or like HCl once the function of the stomach is done, or once the function of intestine is done. And this is how like the whole system works. And it can also affect, like, okay, I want to just go a little bit into like emotional state that I say, like how it can affect. Like parasympathetic is like, they consider just rest, digest, and sympathetic is fright, fight. But there is also another component of parasympathetic nervous system, which is shutdown, freeze phase. So those are connected with some trauma. And always when we treat pelvic health, we have to consider the mental aspect of, psychological aspect of patient as well, because many times constipation is like they are not able to eliminate, so they are like, not having enough movement. So sympathetic, like constantly fright fight situation, or if they have sometimes like too much movement going on and they have like a lot of diarrhea going on, that affects their nutrition, that affects their whole, even like, when you're in anxiety or you have fright fight, you are tightening a pelvic floor as well, so you're not able to let go, you're not able to release that. So that is like, we have to consider the nervous system while treating the pelvic function. It's very, very, very important. Breathing is very, very, very important. We all can swear by like, oh, breathing is so important, breathing is so important. But many times, like, how do we breathe, how the breathing mechanism work, it's always been missed. So I'm going to like, just go a little bit detail of how, like, the like muscles are connected in the breathing mechanics, and how do they work to help to regulate intra-abdominal pressure, help for like, our core muscle functioning. So now, like, recent research suggested that we have 4 core muscles. So one is diaphragm, second one is pelvic floor, third one is abdominals, fourth one is multifidi or the back extensor. So they are like, making the canister here. Now, when we breathe in, what happens? Diaphragm has to descend down. So pelvic floor also follows the same route. So this will go down, this will go down, and abdominal muscle relaxes, back muscle relaxes. So it blows like a balloon, like a 3D or 360 degree. We have to breathe. And when you breathe out, diaphragm goes up and pelvic floor goes up back to the neutral. And then we have to like, abdominal muscle contract, back muscle contracts. So if this muscle is tight, then diaphragm tries to go down, but this is going to like, get stuck, and that creates uneven pressure here, and which is not good for the organ functioning, because intra-abdominal pressure is good, but uncontrolled intra-abdominal pressure, which is no good, because it can put strain on the organ function. I'm going to show you how organs move during the different, like, breathing mechanics. And so let me just show you that video of like, how the organs are moving during the breathing. So here is the video. So when you breathe in, see, it goes down, the liver, the intestine, kidney, everything goes down. The heart is getting enough room to pump. And when you breathe out, it goes up. So Tom Myers, he said that kidneys move almost 0.5 kilometer a day. Same thing with intestine, liver, everything. So that helps with the mobility of muscle. That helps with the function of organs, because organs are getting like massage. So intestine can function better. So what if we don't breathe right? What's going to happen? These all organs will get stuck. They cannot move. And same thing, if organs are stuck because of either fascial restriction, or if we are too like, clenching our abdomen, like we are constantly holding our stomach in, or if we have like constant fright fight, like constantly we are, under fear, or if we are holding too much, like in our abdomen, or sometimes we just hold our breath, we don't breathe deeply, or under stress, or like, many other factors, or endometriosis even can affect the movement or the flexibility of like, all these organs. And that can affect so much of our intrinsic stabilizing system that is coming from intra-abdominal pressure. So this is like a very, very, very important thing. This is the functional MRI, which shows, because normally when we take the MRI, it can just show you the organs. But it's very important to know that organ needs to be moving too. And that's why visceral mobilization concept has been developed, that we need to make sure that all the organs are moving, and they are like, getting enough circulation, and they are not restricted with the movement, so they can function well. So I'm going back to functional anatomy. So this is another video that shows like this is your diaphragm, the back.
Excuse me, ma'am. Sorry to interrupt
Yeah,
for a second. Ma'am, your audio
yeah.
is not visible, ma'am.
My video is not visible at all.
No, ma'am.
Which one? Which
Previous one
one?
was also not visible.
Huh? I'm sorry.
The previous
Which
one was
one was?
also not.
I'm sorry. Just a minute. Which
Okay.
one was not visible?
Ma'am, right now your screen is also not visible.
Oh, I can. I don't know. Yes, right now my screen is not visible, but okay. Let me show the like you didn't see the video of like a breathing with the organ movement.
No, ma'am. No, ma'am.
Okay, let me open it up then again.
Okay.
So where was that? Here you go. I can share the video here. Can you see it now?
Yes, ma'am. Yes.
Perfect. So this is how the whole organ mechanism works. Like when we breathe in, the diaphragm goes down. So the liver, the stomach, our intestine, everything goes down. And as we breathe out, it goes up. So when it goes down, the lungs get enough room to like expand, the heart can pump, and when it goes up, it can just move back. So this defines, like Tom Myers say, like, our kidneys move almost half a kilometers a day, and same thing applies to all other organs. So these organs, they need to move in able to function, in able to get the circulation, in able to like, do the right function. So if they are stuck, our lungs cannot fill with the air, the heart cannot beat enough, like, the strongly the blood, and then also like, the intestine cannot digest the food, or the urinary tract cannot like, produce enough urine or clean the blood. So this thing needs to be moving, and that's the reason why the whole concept of visceral mobilization has been developed. And this is a functional MRI of like breathing, where they're showing that like when you're breathing, and they are taking real time like MRI, which shows like how when you breathe in, the diaphragm goes down, and then how the organs are moving. So if we are stuck in the shallow breathing, they cannot move this much as well. So that can affect oxygenation of our lungs, that can affect the function of our organs as well. And also like endometriosis or some other issues, or even if we are like holding our stomach muscle too tight, clenching, or stress, anxiety, that can also affect the whole like movement of our organ and breathing mechanics. So that's why breathing is so important for normal functioning of our system. Now I'm going back to the slides. Okay. So here you can see the diaphragm, pelvic floor, they work together, and this is the abdomen and the back muscles. They are working together. So they are all 4 core muscles. They work to balance our intra-abdominal pressure. They are working together to help the core muscle to work to stabilize our spine, our pelvis, our hips, and also like provide oxygenation, provide the organ function. So I have the video of this movement as well. So let me just start that video. Here is the video of how it works. You can see that like this goes down, this one goes down. and this two expands. So it's very quick video that how it moves like it's a drop. So when this one goes down, this one goes down, this one expand, and here it expands. And that also help to relax the back muscles, because we don't need constant tightness here. We don't need constant clenching here as well. They need to be moving. See, muscle can be only strong enough if they are contracting and they are relaxing fully. So that's why they have to go through like a down, like, down and then out and then coming back so they can function. Now I'm going back to show you like how the normal breathing mechanics work. Here is a video, like how when you breathe in, it has to expand everything here in the front, side, and back. And when you breathe out, it needs to relax completely. Okay, here you go. So that is like very important, the diaphragm, pelvic floor, abdominals, and back muscles. They are very important during breathing mechanics. Diaphragm, pelvic floor, abdominals, even psoas, hip adductors, coccyx, sacrum, everything, back extensors, they make like a U shape, like a hammock, and they share the fascia through the deep chain. So anything is tight can affect the movement. Now, I want to consider the intra-abdominal pressure, which is also very important because they are intrinsic spine stabilizing system. They are not only stabilizing spines, but also provide the support system to our organs. So they are very important for organ functioning. Here I have made the model. I'm going to show you video as well, that how when the organs are inside, like the pelvis, inside the muscle, and this is the canister, like abdominal canister. Now, what happens when you wear too tight clothing, or if you are holding the breath while lifting, or when you are like, doing any kind of like, any kind of like severe heavy lifting and holding the breath, then pressure goes downwards if you're holding the breath. And if the muscles are not strong enough, what's going to happen? The organ prolapses, poof, here down, or it can create the pelvic floor muscle dysfunction. Or else the pressure can go upward and it can cause even hiatal hernia or like acid reflux, anything. So let me see if I can like find the video of like that, how the intra-abdominal pressure can impact the organ function, like, can lead to prolapse. Example of normal pressure when the whole breathing is regulated and organs are contained within.
Ma'am, again the video,
Again, the video. Huh?
the video is not visible.
Again?
Yes, ma'am, we can
Hold on.
hear the sound, but the video is not visible.
Let me try again then. Because I just shared the okay, let me try again. Okay. Can you see now?
No, ma'am,
Ma'am?
not yet. No, ma'am.
Okay. So I don't know why it's not visible. So I can just go on, move on to the next one then. Because I'm not sure why it's not coming up. But it's just like the same thing, the balloon, when we like, when you squeeze that bottle, when you have too much pressure, what's going to happen? It's going to go pop down, or when it's too much pressure upwards, it can just pop up. So it's very important to have like a balanced pressure system and balanced breathing pattern, to prevent too much strain on either pelvic floor or the diaphragm here, because diaphragm has the opening for the esophagus. And if it is like stuck, or if it is not functioning right, and too much pressure here in the abdomen can put the upward pressure, boom, and then people can have hernia or acid reflux, like acidity or something like that. Also, the pelvic tilt can, affect the pelvic floor contraction and relaxation as well, which I'm going to explain more in the future, like next slides. But like when we tilt the pelvis forward, it can contract like a forward muscle, like anterior muscle of pelvic tilt. And when you tilt it backwards, it does the contraction of posterior pelvic floor muscles. So like mainly the anterior pelvic floor muscles have opening for vagina and urethra, and then a posterior has like for anus. Now it's like a hammock, so they are related with, like, they are attached to the glute maximus, obturator, hip adductors, and also the ligaments. So any like mobility, any restriction in mobility in hip, spine, any area, that can lead to pelvic floor dysfunction. And also pelvic floor muscles are divided into two parts, like a fast and slow twitch. So basically fast acting, they work like they contract and they relax fast. On the slow acting, they contract slowly, they relax slowly. So fast twitch muscle, they can help with the urination, like passing a gas or defecation, while slow can help to provide stability to the organs of pelvis. Now, how do we do the process of urination? So this is like an empty bladder. Now, slowly the urine start filling in. It fills more and more. Now we get the sensation that, okay, now we have to so pelvic floor is at the relaxed state, not like contracting, not relaxing completely, but this sphincter is contracting and just closed. Now once we get the sensation, the detrusor muscle contracts, and then pelvic floor relaxes, and then this sphincter relaxes. Now sphincter and detrusor is not under our control, because they are mainly parasympathetic, sympathetic nervous system. So once the bladder fills with certain level, it automatically does the contraction and this relaxes. But if pelvic floor is tight, it won't let the urine empty completely. So sometimes you might have some retention here, or sometimes people can have like constant dribbling kind of thing. So that is incontinence. So that's where the pelvic floor plays important role here. Now the whole defecation process, like how the stool is formed. So when it goes to the intestine, the stool loses the water, and it just kind of and nutrition goes, and then it passes through here like this. But the Bristol has developed the stool chart, because that defines whether our stool is normal or not normal, whether you have constipation or having some issues that requires either it requires medical attention. Basically, if you have either parasitic infection or you need fibers in your diet. So first two types are basically hard, or they are like a small amount, and that is more like a constipation. This third, fourth is category considered as normal. Even fifth is normal. 6, 7 is more like a diarrhea who require more fiber to make up the stool. Now, and this is very difficult when people have either infection, or if people can develop incontinence, like they can have fecal, stain, or they are having some stains of their stool because they cannot control it if pelvic floor is not working right. Constipation is another thing, that when people think that they go every day, that doesn't mean that they are not constipated. It depends on, that's why consistency of stool is very important. Because if it is hard, if we have to strain, that can affect pelvic floor functioning, and that means you are constipated. So now how we can correlate the functional anatomy to the pelvic floor dysfunction? So any postural changes can affect the function of muscle. Muscles are connected through the biomechanical chain. So function of one muscle can affect the function of other. Joint stiffness can also affect the muscle function or vice versa, and organ function can be affected by muscle joint nervous system dysfunction, or like it can affect, like, organ dysfunction can lead to muscle joint nervous system dysfunction as well. So here is an example of posture, how it is affecting. Like, this is our normal body, where center of gravity is situated here somewhere at S2 level, like sacrum vertebra S2, and it passes through our, like, mustard process, shoulder joint, and then, like, a little bit behind the hip, and then knee, and then ankle. That defines how the joint is resting, and how, like, they are in optimal position for functioning. So if the line of gravity, like this patient had some issues with her hip, and then she had some prolapse issues, but you can see how her body is like this. It's not straight. Like, her hips are shifted forwards, the knees are hyperextended, the back is kind of like, having lower back is hyperextended, and the upper back is more shallow. And that affects the muscle functioning in the body, and that can, once the hips go back into the socket and the body aligns the way it is, the prolapse issues went away. So that is major thing that we do it in the clinic, that take the picture of patient in the side view, in the front view, just to understand how their body is sitting. Are they aware of their own posture? Are they aware of, like, how the muscles are working? So there are like 3 or 4 different kind of like posture that can affect the pelvic floor muscle and muscle chains. So one is like a flat back, like a lumbar spine is pretty flat here, in which like a hamstring is tight, and then, like, this abdominal, like a abdominal muscles are kind of like a little bit tight, and the back and this psoas muscle is super, iliopsoas is kind of like super tight, and that can affect like the whole, hyperextension and pelvic functioning, because they are stuck here. So when they try to sit down or something, the hips cannot move, hip is stuck forward. So hip is stuck basically in extension, and so it's not moving like the way it's supposed to be into flexion to provide the stability. So that is another, like, one of them. Second one is like similar to the sway back. So mainly, like, it's a lot of thoracic kyphosis here, and then the more posterior pelvic tilt. So glutes are clenched, so they are tight here. The abdomen and here hamstring, they're super tight, and, like, iliopsoas or like obliques, and then, upper back neck flexors, they are weak here and elongated. So like knees are hyperextended, so the line of gravity is not passing the way it's supposed to be, and that can affect the muscle functioning. And all these muscles are connected to pelvic floor, so they are going to affect the pelvic floor muscle, pelvic organ functioning. This is like a hyperlordotic curve, where you can see that there is a tightness into hip flexors and then neck extensors, and also the weakness into the upper back, hamstring, and obliques. So that is like leading to anterior pelvic tilt, and which can also affect the tightness in the anterior part of the pelvic floor muscle, and which can affect vagina or, bladder. And when it is posterior tilt, that affects the posterior part, so rectum, and our anal canal can get affected, and their functioning can get affected. So now when we look at, like, those were the side views. Now when we look at the front, how it can affect the shoulder positioning, the hip positioning, and the knee and the ankle. So as we see the neck, even when this shoulder is down and this hip is up, that defines the latissimus is tight here, and this latissimus is long and weak. So that can affect the glute muscle function here. So if this is tight, that can affect the tightness in the glute here, and the weakness on this side of the glute muscle, which can affect the knee, hip, ankle, pelvic floor, anything on this side. So many times when patient come with, like, right shoulder pain or like right hip issues, that this latissimus is first one to be assessed, and make sure that there is, like, also the neck mobility is there, the hip mobility is there. So when we look at the patients here and taking the pictures, the same thing. See, this shoulder is higher, this is down, this hip is higher, this hip is lower. So this side of latissimus is super tight, this is elongated. So this side of, like, glute will be tight and this side of glute will be like super duper weak, and that can affect the sacroiliac joint stability, that can affect the knee stability, everything. And then this is like a before after kind of picture that we take it like just to give them like more idea that how much improvement they have made, and that develops more body awareness. This is more holistic thing that they need to get connected to their own body and able to understand. So many times people, when they are like stressed, when they don't understand anything, we have to calm them down. Taking the picture visualization can help them to understand where their body is sitting and how they can work in that body. Um, Here is like a funny example of like we should not be talking on the phone while walking, because mainly for the long walks, because many times patients complain that, oh, my SI joint hurts when I walk for like few miles. First question, do you talk on the phone? Because you are blocking these hands, so you're blocking. The latissimus is like chilling here, not working at all. So glute is crying that I don't have anywhere to go, and the upper trap is definitely angry because it's overworking right now. So basically try to find out like why people have pain is like what they are doing functionally during the daytime, and are they really working in that chain movement. Now the pelvic floor pain tightness causes. I'm just going to go a little bit brief about how the pelvic floor tightness can happen or the weakness can happen and what it can lead to. So basically visceral pain, as organ, like if we have like some issues going on with intestine or bladder, like UTIs or anything, that pain can also cause muscle spasm, and that can cause muscle dysfunction or the whole canister or the abdominal dysfunction. Childbirth is another thing because it can create trauma to the pelvic floor and also the sacroiliac joint, or anywhere. Also the dysfunction. Biomechanical abnormality like a hip arthritis, knee arthritis, or like SI joint dysfunction, low back pain, anything can be associated with the pelvic floor tightness or weak, or pain. Pelvic floor clenching, or like when we clench our stomach a lot, like because everybody wants a flat tummy, everybody wants to like oh, clench your tummy, brace your abdomen. No, you don't need to brace all the time. They have to have proper optimal position. They can fire on their own and provide you stability. Overuse, too much exercises in a very bad form. Also repetitive bladder, vaginal, or the prostate infections. When we have that, like definitely it creates like a nerve sensitivity and the pain and muscle dysfunction. Now, weakness can be caused by pregnancy because the weight of the baby that can put so much of load on the pelvic floor, and they get like too much stretched. Also, abdomen is being stretched. The back is kind of a little bit tight. Diaphragm can be stuck. So that can affect the whole breathing mechanics too, and which can put a lot of load toll on pelvic floor muscles. Age, we can define that because of the age-related weakness can happen. Also chronic constipation. We always need to address that. If you go every day, it doesn't mean that you're not constipated. As long as you sit on the toilet and if you go within few minutes, that means you are not constipated. But otherwise, if you have to strain, if you have to like really work hard, you are putting strain on your pelvic floor, and that can lead to pelvic floor dysfunction, prolapse, anything. Too much weightlifting. You don't need to excessive weightlifting. You can lift, you can reach towards it, but if you're doing too much and if it is increasing your intraabdominal pressure, it's going to go down to your pelvic floor. Here you go, boom. Chronic coughing. Again, same concept, intraabdominal pressure. If we are coughing too hard, and that can lead to downward pressure. If it is a chronic, then muscle can give up at one point. And obesity can be one of the causes too, because the weight, body weight, they cannot tolerate it. Now, the pelvic floor muscle dysfunction, like, what kind of symptoms they, feel, like burning pain or constipation or bowel incontinence, like they have fecal stain or leak, and they don't know even about it. Itching, yeast infections, urinary leaks. Itching and yeast infections are related with the muscle tightness. Urinary leaks, frequency, urgency, incontinence. So many women, when they complain that, oh yes, after I had a kid, when I jump on trampoline, or if I laugh loud, or if I yell at my kid, I leak. And it's part of motherhood. No, it's not. It can be common. It's not normal. it needs to be addressed because our ribs went through a lot during, like, when we had the baby in our tummy. So we can have stuck diaphragm, we can have tight psoas, we can have tight back muscle, we don't have right breathing mechanics, we might have weak abdominals, we might have either tight pelvic floor or the weak pelvic floor. It's like the whole thing needs to be worked up. Otherwise the leak can happen, and then it can, many people, they end up like giving up on their activity, like running, jumping and everything, or they end up wearing those pads, which is not a good idea, because this is treatable. Pain during intercourse, hernia and hemorrhoids, again downward pressure that can lead to, like, weak part can just pop out, like inguinal hernia or hemorrhoids. Definitely they can be treated with the managing intra-abdominal pressure during functional movements. And we can go on and on squat form and many other things. Hip pain, low back pain. There is a high relationship between hip arthritis or hip pain, low back pain, because of the glute muscle firing, the multifidus firing, and the pelvic floor function. And feeling of fullness in vagina, like prolapse. That's a whole lot another thing that they just accept it. It's normal. It's a part of childbirth, which is not normal. It can be treatable. So 1 in 4 women, they suffer from pelvic pain and pelvic floor dysfunction, and they don't want to see the doctor. They don't want to talk about it because it's a major stigma. So it's very important that we talk about it. We go and get the help. That is the help. And physical therapy definitely can make a huge, huge difference. Recently, I found that in Interstitial Cystitis Society, the American Urological Society, decided that the PT is the first line of treatment for interstitial cystitis. And super, yay to PT, because we can help to relax that pelvic floor muscle. So in urinary incontinence means either we have involuntary loss of urine, either under stress, like when we cough or when we jump, or sometimes we have bladder sensitivity. So when we hear like a shower or running water and we have to rush to the bathroom, or if we are in the bathroom, we want to just do it. So those things, like, we can definitely fix with the help of physical therapy. Like here, when the bladder is filling, we get, feeling here. And then sometimes when we ignore that urge, bladder gets like bigger and bigger and bigger. And sometimes it just gives up. So what's going to happen? Like either we can have leaks or we can just have involuntary loss of urine. Here, the normal poop comes out like this. Now, when we have like a too soft poop, or if pelvic floor is not working right, either it's too tight or too weak, it can lead to leakage. Even constipation sometimes can lead to leakage as well. How? So what happens, like when we are constipated, we have all this collection of hard stool here. Now from hard stool, the rectum becomes bigger and bigger in size. And what happens, like the poop becomes harder and harder because the rectum, it absorbs the water constantly. So this hard poop gets collected. Now the new poop comes here and it goes here. So it is water and it tries to go around here and it here. And then sometimes it can lead to leak for many people because they cannot just go. And this constipation can lead to permanent either enlargement of rectum or for long-term enlargement of rectum. And then we have to use the fibers to increase the bulk of the poop, so enable to people to go, it becomes softer and then people can go easily. So always, like, never ignore the urge to go, because that can lead to really bad constipation and fecal incontinence. And even it can put pressure on your bladder. Bladder is right here in the front, and which can lead to, like, bladder incontinence as well. Urinary incontinence. So there are many causes of constipation. Diet is a huge part. Lack of hydration or too much use of like stool softener or laxatives, and then too much like excessive exercises or pelvic floor dysfunction. And these are like all prolapse, like cystocele. Then like a bladder goes down for and it, like a prolapse means downward movement of the organ. And it can be felt in vagina. So like, this one can, like, cystocele means when the bladder goes down. The rectocele means our rectum goes down. And then uterine means the uterus go down. And that lead to like feeling of fullness and that can affect the organ functioning as well. Sometimes it can lead to burning or, having constipation or other issues. Diastasis. That's a big thing, which can be very common in men and women both when we don't have proper muscle functioning. So diastasis means muscles separate. Here, this is the linea alba and this is the rectus abdominis muscle. When it opens up at the umbilicus level, or it's a little bit below that navel, or it's at the level or above the level or throughout, then it can create like uneven pressure distribution, like intra-abdominal pressure. And also this is like a corset. So it won't provide enough stability to our abdominal system. So that can lead to definitely back pain. 100% woman at full term gets like diastasis because that can prevent like prolapse during the pushing phase of childbirth, but it should heal within 6 weeks. But many women, if they don't heal by 6 months, they definitely need physical therapy there is no specific treatment for diastasis because everybody has some different cause, like a postural things, like a rib flare, if the diaphragm is stuck or the psoas is tight or the hip mobility is affected or their back is super tight. We have to evaluate them thoroughly before we can decide any treatment. Many women, they suffer a lot because there is not enough help, because they think like this, that why it's just me. Is it normal or is it in my head, or I feel like no one believes me? And that is very, very true, because this can lead to chronic pain. And it's very like it's in the area where people don't it's a stigma, taboo. They don't want to talk about it. And there is not much help. Even where I live, there are hardly 3 or 4 therapists in the area. So like people, they don't get enough help in the terms of pelvic health, relief. So now I'm going to go quickly into preventative measures, what we can do to prevent some bowel issues or the bladder issues. So for bowel, you can do like a do. So obviously drink 8 glasses of water, 8 ounce, so 64 ounce. Bowel movement 3 times a day or once in 3 days without any strain is considered as normal. Fibers in the diet can help to reduce constipation. Keeping the knees above the hip level, that can, like using the step stool, which can help to relax like a rectum, straighten the rectum, relax the pelvic floor so we can, poop easily. Breathing can help as well. Keeping the bowel diary, that note down like, how many number of poops happen, like any straining, any leaking of gas or, feces, or what kind of poop it looked like based on Bristol, scale. Is it normal to feel the urge to poop within like half hour of eating, which is totally normal. Prescription medication during the pregnancy can cause constipation and pain from like episiotomy. Okay, first poop is always hard after having a childbirth. So that is a lot of anxiety. So PTs can help how to sit and how to relax and how to just go without like hurting the pelvic floor or causing pelvic floor dysfunction for future. Never ever ignore the urge to poop. Make sure that you go. It's nothing embarrassing. It's a normal function of our body. Lack of physical activity, make sure you at least walk. Drinking too much caffeine can do it. Using laxatives because you just want to go every day, it's not a good thing unless you have MD prescribed. Poor eating habits, make sure you eat healthy food, whole grains. Using the gadgets or book while sitting on the toilet, don't spend more than 15 minutes, otherwise you might end up having more downward pressure with pelvic floor dysfunction and hemorrhoids. And Bristol scale, follow that. Bladder, so drink again 8 to 10 glasses of water, so that can help with the whole formation of urine. And then urinate every 2 to 3 hours. Okay, if you don't urinate at every 2-3, like if you urinate at 6 hours or if you have to urinate every hour, they both are no good. So make sure that like you have at least interval of 2-3 hours during waking hours. Also urinate at night is like, if you have to wake up frequently at night, which is not good either, because unless you have some medical condition going on or the pregnancy. And also like if you have issues, then always eliminate the irritants like, caffeine or too spicy food or acidic food or alcohol, carbonated drinks, that can be bladder irritants. So just find out your irritants and work towards it. So the bladder and bowel, you can train them the way that's why, like, in India, like, I growing up, I remember that they make sure that you go poop every morning. Okay, you go and pee like this. So when they train even baby to poop, they make sure that they time it. So those things are so important for pelvic health and pelvic floor functioning. um don't do just in case pee. Oh, I have to go out and maybe I may not be able to find a bathroom or something like that. And in that case, people pee a lot before they leave, and even if they're not ready. So your bladder is getting like different weird kind of habit for that part. Power pee or push pee, don't force. You have to relax your muscles. So never practice Kegels while you're on the toilet. Kegel is not the solution for pelvic floor dysfunction because your muscle can be tight. You need to make sure that they are working right. And constipation, treat first, otherwise it can put pressure on the bladder, and that could be one of the reasons for incontinence as well. Run to the bathroom with every urge. If you have the urgency issues, like when you hear the running tap water, and then you feel like, oh yeah, I have to go, just try to breathe. Try to like calm down your system and see that you really have to go. Sometimes you can calm down and you don't have to go. And limit fluids to avoid bathroom trips. That's one of the worst things that you can do it to yourself. Make sure you drink enough water, because people, when they travel, they don't drink enough water. That leads to constipation and other issues. It's okay to drink water because you need water to survive and digest and other functioning. And as a PT, we can definitely make a difference. We can help these people. And like when pelvic floor issues come, they are never alone. They are always having some associated like orthopedic things going on, like a hip pain or back pain. Same thing, people with a hip pain and back pain, when we talk to them, they open up about their pelvic floor dysfunction. I can tell you in the clinic, I see like 90% people might have pelvic floor dysfunction when I talk to them. And, they're like, oh, I have it for years. Is it really help? Like, do we have any help for that? Yes, we do have a help for that part. And we are very important part of that whole like pelvic health system. Do you have any question regarding that?
Ma'am, this session is not interactive.
Yeah. So, like,
Thank you so much, ma'am. Thanks for sharing
sure.
knowledge. This session is really very informative, and I know how busy you are, and we are really grateful to have you with us. And I extend my thanks to our principal, sir, Dr. Gaurav Patel, sir, for providing support to make this webinar successful. Many thanks from all of us to you, ma'am.
Thank you so much. Thank you. Have a good day.
Wishing you the same, ma'am. Bye.
Bye.